Welcome to this PDR Live. Thank you very much for waiting. Thank you for joining our live stream. Please like the live stream and subscribe to our channel if you have not done so already. So today is day 5, the conclusion of day 5 of the manhunt for the United Healthcare Assassin. Um, and there are mixed messages about the identity of the shooter, whether the authorities actually know who the shooter is. We'll briefly go over that, and also some more background information on the CEO Brian Thompson. The reporter Clem Klippenstein unearthed some very interesting court documents relating to a previous altercation that Mr. Thompson had about 7 years ago with law enforcement, and he did have a criminal record. And finally, if we do have time, we'll go and view a video from a year ago from the Young Turks regarding United Healthcare. And the timeliness of all of this is very, shall we say, convenient, given the fact that that video came out a year ago regarding United Health's healthcare's practices. So this is the update so far. This is from the USA Today. CEO Brian Thompson shooting. Please like the live stream, and subscribe to our channel if you're not done so. And the subtitle here is that the net is tightening in search for suspect. New York City mayor says the net is tightening in a search for the gunman who brazenly killed United Healthcare CEO Brian Thompson in Midtown Manhattan. New York City Mayor Eric Adams said Saturday, "We're going to bring this person to justice," in a video published by MSNBC News. The mayor said. The search has stretched into its 4th day and appears to be expanding as police say they believe the killer successfully fled New York City after the shooting. The FBI said Friday it has joined the search and is offering the $50,000 reward toward the reward for an unknown suspect seen in previously released photos. On Wednesday morning, Thompson's killer covered his face and was waiting outside a Hilton hotel, where Thompson, 50, was set to speak at an investment conference. Officials said surveillance cameras caught what happened next on video. When Thompson appeared, the shooter fired multiple times from behind him at close range at about 6:45 a.m. Authorities haven't said whether they have identified the suspect. "We don't want to release that now," Adams said. "If you do, you're basically giving a tip to the person we are seeking, and we do not want to give him an upper hand at all. Let him continue to believe he can hide behind the mask." So this is what's coming out of the mayor of New York's mouth, that kind of almost insinuating that they do know who this person is. So that's supposedly what they have at the moment. And of course, they did a scuba dive search in one of the lakes in Central Park. They're searching for the weapon. They have not found the weapon at all. And the backpack was found in the park, and apparently there was Monopoly money in the backpack, and a Tommy Hilfiger jacket was found there. So this is here. We're going to take a look at CBS New York here. Take a look at this clip here and see the reporting right now regarding this incident at this moment. So we're going to just go ahead and cue the video here. Just give me just 1 second there. And here we go.
NYPD divers searched through the murky waters of the lake in Central Park again today, hoping to find the weapon used to murder United Healthcare CEO Brian Thompson. Meanwhile, the manhunt continues for the gunman who killed Thompson outside a Midtown hotel last week. Christy Kalishian has the latest on the investigation.
The person of interest police are looking for, seen here in the back seat of this taxi, still with his mask on, and another image of him just outside of it are the latest images released by investigators. Here he is without a mask. The FBI released this poster with a $50,000 reward.
But the net is tightening, and we're going to bring this person to justice.
Sunday, dive teams returned to the lake in Central Park for a second day, finding this backpack Friday believed to belong to the suspect. Forensic testing results still need to come in before determining whether it's linked to the shooter, who's seen on surveillance video gunning down United Healthcare CEO Brian Thompson outside a Midtown hotel on December 4th. Mayor Adams on Saturday said they know his name.
We don't want to release that now. If you do, you're basically giving a tip to the person we're seeking, and we do not want to give him an upper hand at all. Let him continue to believe he can hide behind a mask.
The only images believed to be of the person of interest without a mask were captured on surveillance cameras from inside an Upper West Side hostel, where police sources say he had a flirtatious encounter with the front desk employee. On Saturday in Central Park, a woman we spoke with says she saw the NYPD dive teams in the lake, but didn't see them come out with anything.
This corner was blocked off with like probably 5 policemen, 1 van, and then we saw scuba gear and a couple divers getting in and just kind of like splashing around, looking only in this area.
Still closed off with caution tape is the area of the park where police say they found a backpack possibly linked to the suspect.
So that's there it is. They know who the shooter is. They know his name, and they don't want to release that. That's according to CBS News. Now, here is a different take, actually, from NBC News reporting. They actually reported the following here. So we'll take you to that right now.
Police are calling a person of interest in the murder of United Healthcare CEO Brian Thompson on a Midtown Manhattan street. They're from a taxi cab, the same cab police say he took to a bus terminal after the murder, before the trail went cold. Police saying they think he's left New York City. Those photos, the latest images of the man police have been tracking since last Wednesday, including at the Manhattan hostel where he stayed, a stop at Starbucks, and then near Central Park. That's where this weekend police found new evidence, a backpack they believe belongs to the suspect. The case taking a strange twist when they revealed what was inside, a jacket and Monopoly money. Retired FBI agent Rob D'Amico told me that could be a message to investigators.
Do you see something that seems to come out of left field, like the Monopoly money? What do you take from that?
You look at it and you're like, was some purpose of that? Or was it literally something so benign that it wasn't even part of it? Like, why Monopoly money? What would bring it to it?
Today, elite NYPD scuba teams back in the park, scouring the ponds for evidence. The weapon still missing. The investigation now expanding nearly 1,000 miles away to Georgia. Our Kathy Park is there.
Authorities say the investigation is widening to places like Atlanta, where officials say they're looking for clues at bus stations. They believe the suspected shooter could have come through here before heading to New York.
Senior law enforcement officials say they still don't know the suspect's ID. One of the tools they're using comes from the NYPD's facial recognition unit.
We have cameras over here.
Darren Porcher is a former NYPD lieutenant who used to work near the bus terminal where the suspect was last seen.
We have cameras across the street, but you have to take.
So there you have it, folks. You have CBS reporting that they have the identity of the shooter, and NBC actually reporting, well, as a matter of fact, we don't know who this person is. We still don't have a clue. So kind of a cat and mouse game that's going on here, wouldn't you think? So this is a Fortune today put out this article, and I'm just going to go ahead and take a look at this title here. It says, the headline says, monopoly money was found in a backpack believed to be worn by the United Healthcare CEO's killer, and what could be another cryptic message. There it is. And oh, it's blocked, but it's actually not blocked on my end over here. Actually, I think we can go over to this over here. I thought I had the article here. Here we go. No, it's not this one. My apologies. Let's see here. So I think that was a paywall there on the piece there, but so I thought I had the article somewhere here. Here it is. Just found it. Thank you so much for your patience there, and so that's actually it right there. So here we go. So the monopoly was found in a backpack believed to be worn by the United Healthcare CEO's killer in what could be another cryptic message. And it says here, the gunman who killed the United Healthcare CEO Brian Thompson remains at large, but more clues are turning up, including the contents of a backpack believed to have belonged to the shooter. Sources told MSNBC on Saturday that the backpack, which was found in Central Park, contained a Tommy Hilfiger jacket and Monopoly money, but it didn't contain a gun. The report was later backed by other news outlets. The New York Police Department didn't immediately respond to a request for comment. Police divers searched for a gun in a Central Park lake Saturday, and the NYPD has said the weapon that the shooter used to kill Thompson could have been a veterinary pistol. Images of the gunman showed him wearing a distinctive backpack, drawing immediate attention to as a potential clue to his identity. CNN reported that it was in fact made by Peak Design, and the police examined it as a forensic lab in Queens. The presence of Monopoly money raised questions that it could be another cryptic message after bullet casings found at the scene of the crime had the words "denied, defend, and depose" written on them, an apparent reference to practices in the insurance industry. Former Washington, D.C. homicide detective Ted Williams told Fox News that the Monopoly money is the, quote, killer playing games with the authorities, all part of a cat and mouse game. He added, this killer knew they would more likely than not find the backpack, and he is leaving breadcrumbs to let the authorities know that he is in control, not them. So that's clearly painting a different picture that the mainstream media wants to put out there, that this person is almost on the brink of being caught, and it's only a matter of time. The mayor argues that he is he is about to be nabbed by the authorities. Quite interesting. Earlier today, Clint Klippenstein reported the following. He did some investigative journalism, and I believe he probably did a records request from the state of Minnesota, and uncovered the following information about CEO Brian Thompson. And this is what he discovered. He discovered that Thompson pled guilty to drunk driving, which he served a couple of days in jail at the Hennepin County, the adult corrections facility in Minnesota, and a later probation. So this is the paperwork, folks. It's right here, state of Minnesota, county of I don't know if it's a Hennepin but that's the writing was really bad here. But top right hand corner, you have the judicial district is the 4th, the court file number, and state of Minnesota plaintiff versus Brian Robert Thompson. Petition to enter a plea of guilty, a misdemeanor or gross misdemeanor case pursuant to Rule 15. And the document here says, I wish to enter a plea of guilty in the above titled case, and I hereby state to the court the following. Number 1, I am the defendant in this case. My full name is Brian Robert Thompson, and my date of birth is July 10th, 1974. I am charged with 4th degree DWI, which of course stands for driving while intoxicated, in violation of 169A.27.1. Hereby plead guilty to the offense of 4th degree DWI in violation of same statute. I'm pleading guilty because on March 11th, 2017, in the city of Maple Grove, county of Hennepin, that's what I think it was, Hennepin. That's a really terrible writing. On the top left hand, it looks like Henneman, but no, it's Hennepin. I've heard of that county before. State of Minnesota, I committed the following acts. State sufficient facts to establish a factual basis for all elements of the offense to which the defendant is pleading guilty. So these are the instructions given to him, and this is what he wrote. I drove a motor vehicle while impaired. Okay, so that's the matter. And again, the reason this is not to claim that, of course, we're not saying that CEO Thompson deserved an eye for an eye, right? He was a drunk driver and therefore he deserved to die. No, that's not what we're saying at all. What Ken Klippenstein has been saying is that the mainstream media is reporting about him, and this is one article that he actually linked. It's just presenting a very positive picture of this man, and this is just one example here of the coverage from the Minneapolis Star Tribune. And in this article here, it states the healthcare executive, Maple Grove resident, shot and killed in New York on Wednesday morning, was remembered by co-workers, community members as a leader and devoted dad. So on this article, if you go all the way down here, one of the things that Ken Klippenstein mentioned here was this quote from Jeff Harmoning, chairman and CEO of General Mills and chair of Minnesota Business Partnership, was one of the many to call this death shop. He was a respected business leader who spent over 20 years with United Healthcare. He was a beloved father, husband, and a good friend to many here, and he will be truly missed. So this narrative of this man just being, oh, he's a good person, and the background information on him that the mainstream media is really presenting this guy with is very flowery language. And if you recall from our previous live stream, this man had also been accused of insider trading. He had been accused and was under him and his company, and the other executive, Andrew Whitty, were about to be investigated by the federal government. And when they found out, they decided to sell their shares in the company. And actually, Mr. Thompson sold upwards to $15 million worth of shares that he owned in the company before the investigation was announced. And finally, the stock price actually did tank after that announcement was made. So he had been accused of insider trading and was under investigation for that. So you have these articles where the mainstream media is just making this guy appear like he's the Saint Bernard of the healthcare industry. I'm going to take another look here at this article here, and we have here, and it's actually United Healthcare CEO fatally shot in Midtown Manhattan, and this was actually on the day of the shooting, December 5th, 2024. And even back then, I noticed something that when you go back here, this is what they were reporting here. United Health Group CEO Andrew Whitty addressed the shooting in a minute-long video sent to employees. And that's the quote there. There are no words to describe how many of us are feeling right now. Brian was a truly extraordinary person who touched the lives of countless people throughout our organization and far beyond. It's a terrible tragedy. I know we are in shock and in disbelief. We are deeply saddened and shocked at the passing of our dear friend and colleague Brian Thompson, the CEO of United Healthcare. A public statement from the company said, Brian was a highly respected colleague and friend to all who worked with him. And then you even had the current Minnesota governor, former vice presidential candidate Tim Walz, who knew him, by the way. He actually knew this man. He called the Thompson's death a terrible loss for the business and healthcare community in Minnesota. This is a horrifying and shocking act of violence. My thoughts are with Brian Thompson's family and loved ones and all those working at United Healthcare in Minnesota. U.S. Senator Amy Klobuchar of Minnesota said in a post on X, I'm horrified by the assassination of my constituent Brian Thompson this morning in NYC, and have his family in my prayers. So it's like the mainstream media had been trying to present this guy as really a good guy. You know, he's a decent man, a family man, a good friend, a dear friend. But we're finding another side of Mr. Thompson. That Washington Post article, which is only one article among many articles that were being put out by the mainstream media, showing the sort of tactics that they were being accused of. This is a tweet here from that tweet that they were talking about there from Amy Klobuchar, and these are some of the responses here. Curious Amy, when those of you in Congress thought wise to keep a middleman in healthcare that is paid to deny healthcare, where did you and the rest of the insatiably greedy Congress members believe this would head? As far as I'm concerned, Congress killed this man. Hashtag Medicare for all. I'm guessing they gave you money. What's horrifying and shocking that this was going on in your state and in our country for so long. Despicable. And this person reposted Ken Klippenstein's post here. Here it is. This is apparently this is what he posted on his LinkedIn. We work every day to find ways to make healthcare more affordable, including reducing the cost of life-saving prescription drugs. I'm proud of the work. And there. And then Brian Thompson, this seems like a laudable mission, but a United Healthcare Group is failing my mother by not providing her the basic care to get better and back her life. You continue to delay any decision making and authorizations, which is compromising her health even more. And if she doesn't get back to her baseline, United Health Group is partially responsible. She's ready to get better, but instead, it says here, this message is an example of hypocrisy at its finest. You are denying claims of people who need it. The only thing this company is good for is screwing their customers. So that was him on his LinkedIn. These are the replies. You are doing a great job cutting our costs. Not having a single anesthesiologist in network in the entire state of Montana is a great policy to save you money. Hey Brian, I just spent an hour on the phone battling to get general information for my wife with stage 4 cancer. She's a 45-year-old mother of 4 with an abnormal EGFR gene. I'd love to share my experience with you. 860-208-4053 is my cell phone number. Beatrice Sia, this is terrible. They like to see people suffer, not cover their claims. So that's, folks, is what we've been saying here. Where is all this sympathy for the people that are suffering? Here's Dean Phillips' tweet on X that was mentioned in that CNN article, and here are some of the responses. I'm horrified by the privatized healthcare system that made him wealthy by denying people services they need to live. You people are so out of touch. You are the sick, greedy one. Horrific, thinking about his family. So that's kind of, so there are some of these comments that I did see here that were at, but this was on the day of the shooting. So I wonder if these people now think differently, but there were some who did offer their thoughts and condolences. And this person seems like excited about the news. And that's one comment there that I mentioned. Dean, I know you know this, but this simply cannot happen. We're horrified by all the violence in New York City. So I think they're pointing out that, look, you're making a big deal out of this one person's life over all these other lives that are being affected in New York by crime, or this person through his company's policies. You're responsible. We should have single payer healthcare like every other civilized country. So if you want to avoid this kind of thing in the future, do your job better. And this person here, so many disturbing responses to this post. So this person here does not agree with all of the sentiment. But look at his profile. So yes, venture capitalist right there. That's a venture capitalist for you. Put these people in your prayers instead. Right, so let's take a look at what it says. United Healthcare accused of AI used to wrongfully deny claims. And yeah, class action lawsuit alleging it used an artificial intelligence algorithm to wrongfully deny coverage to elderly people for care under their Medicare Advantage health policies, which Medicare Advantage is just a horrible, it's a privatized system under Medicare. So that's actually providing less coverage and less care for people and more profits for the insurance companies. So that's that right there. That's the sordid state of affairs of our country's healthcare system. I do now want to take you to a video from the Young Turks, which I'll be bringing up here shortly. And they did an investigative report last year on United Health, which I thought is very relevant to today. And I'm just gonna have to look for it here. So this was from the Young Turks, and Anna Kasparian was reporting on the practices of UHC, and I had it with me here, but on the history of our YouTube channel, but now it's not appearing. It's not on. I don't see it anywhere. I know it's not. This one. Oh, it's this one. Okay, here we go. So we're going to queue up the video right now. We'll take you to this video here. This was actually posted by the Young Turks. Let's see the date here. Find the date here. April 19th, 2023. So more than a year and a half ago that this came out on the Young Turks. So here we go.
United Health Group's chief executive bragged about how the Biden administration's ineffectiveness in cracking down on overbilling in Medicare Advantage has led to record profits. So the CEO, Andrew Whitty, told investors that he appreciates the White House's decision to slow the implementation of its Medicare Advantage reforms, which would prevent companies like United Health from potentially overbilling and stealing from United States taxpayers. Common Dreams writes, United Health, one of the largest Medicare Advantage providers in the United States, reported $91.9 billion in revenue for the first 3 months of 2023, 15% growth year over year, and more than $8 billion in earnings from operations exceeding analysts' expectations. United Health, like other Medicare Advantage insurers, has been accused of wrongfully denying patients necessary care, in some cases utilizing artificial intelligence to determine whether or when to end coverage. And unfortunately, more and more seniors are signing up for Medicare Advantage, with some of them very likely not realizing that it's a privatized alternative to Medicare. The company, meaning United Health, said that it added 655,000 new Medicare Advantage members in the first quarter of the year. Now, we'll get back to United Health in just a moment, but first, here's a little context about what we learned recently about these Medicare Advantage programs. So Medicare Advantage is not the same as Medicare. It's a Medicare approved plan from a private company that offers an alternative to traditional Medicare. Much like private prisons, it's privately run, but publicly funded through the Medicare Trust. Aside from robbing the Medicare Trust through overbilling, other issues with Medicare Advantage includes, super narrow networks for providers that can severely limit access to care for the nation's elders. Many of the nation's largest health insurance companies have made billions of dollars, not just in revenue, in profits, by exploiting the government's Medicare Advantage program. A recent New York Times investigation found that 8 out of 10 of the largest Medicare Advantage providers overcharged the government. In fact, 6 of the 10 have been accused of fraud by both whistleblowers and government officials. Before the Biden administration could implement any rules to mitigate or prevent this fraud, private health insurance lobbyists did what they do best. They went to work. They went to Washington. United Health helped lead an aggressive lobbying campaign against new Biden administration rules aimed at limiting Medicare Advantage insurers' ability to overcharge the federal government by making patients appear sicker than they actually are. United Health CEO Andrew Whitty appeared on Capitol Hill in person to lobby against the proposed changes, which the lucrative Medicare Advantage industry falsely characterized as cuts to the program that now provides insurance to nearly half of the overall Medicare population. Now, that lobbying effort culminated with big rewards for the private healthcare industry. Just last month, the Centers for Medicare and Medicaid Services, otherwise known as CMS, agreed to slow down its regulatory agenda by imposing policy changes over a period of 3 years rather than all at once. By the way, with no justification. Like, why are you slowing down the implementation of these regulations? Is it because the lobbyists showed up and demanded you do so? CMS also agreed to boost Medicare Advantage payments or payment rates by more than previously expected. But just how bad has the overbilling been? We can get to some of those numbers. when it comes to excess billing, CMS, which by the way agreed to slow down their regulations and their crackdowns on overbilling, recently estimated that overpayments to Medicare Advantage totaled $11.4 billion in fiscal year 2022, a significant drain on the Medicare trust fund. Other estimates, according to Democracy Now!, were higher at $25 billion in 2020 alone. Citing one industry analyst, Stat News noted that United Health could reap $900 million in additional profit next year alone, thanks to the administration's decision to delay full implementation of reforms. Insurance giants, United Health, Cigna, CVS Aetna, Elevance, Humana, you get the picture, and Molina saw their combined revenues from taxpayer-supported programs grow 500% between 2012 and 2022. United Health is one of just 7 large for-profit insurance companies that now control 70% of the Medicare Advantage market, which is dependent on taxpayer money, our taxpayer money. Taxpayer money that they steal by overbilling their patients, by overcharging and overbilling the Medicare trust. So it's incredible to me that on one hand, you have Republican lawmakers pretending to be panicked about the solvency of various social safety net programs, whether it be Social Security or in this case, the Medicare trust. Shouldn't we do something about the private companies that are defrauding the system? Shouldn't we crack down on that? And by the way, the Biden administration aiding and abetting the robbery in the first place, it's pretty disgusting. Like, what is he gonna do? Is he gonna blame Trump for that too? This is happening under his watch. The Biden administration is fully aware of what these private insurers are doing in stealing money through overbilling. And they're letting it happen. They're slowing down the implementation of these rules that are meant to crack down on this terrible behavior in the first place. Just something to keep in mind when the Democratic Party pretends to be better than Republicans. Because fact of the matter is, the whole corrupt political system that we're currently living under does not discriminate against Democrats. The money flows into the coffers of Democratic lawmakers and Democratic politicians as well. So just like Republicans, they do the bidding of corporate America. And in this particular case, they do the bidding of private insurance companies that are literally stealing money from the Medicare trust, a trust that we all pay into.
Thanks for watching The Young Turks. We really appreciate it. Another way to show.
So that's the Young Turks right there, Hannah Kasparian. So there it is, folks. You're not hearing this on mainstream media right now. It's not fitting their narrative of this family man, this friend of his co-workers or of his community. So that's the picture that the mainstream media wants to point out. And all of the negative coverage about his company, the business practices, the illegal conduct, his own personal criminal behavior behind the wheel, they're going to, try to bury that as much as they can, or put out an article here and there. You're basically not even hearing that at all in almost all of the cable news networks and in the local. You hear it in one of the local programs in Minnesota. There was one piece that they did at less than 2 minutes that we looked at in a previous live stream. But yeah, and then you have people in Congress, especially Republicans, who want to cut Medicare and Social Security, and yet Medicare Advantage actually overbills the federal government, and you don't hear them trying to phase out Medicare Advantage because of its gross mismanagement, the amounts of spending done in Medicare Advantage where the federal government is being overbilled much more overbilled for things that it would cost less under the Medicare Parts A and B. So Medicare Advantage is Part C, and it was created right around the 90s, which was gave recipients of Medicare like a kind of like a private option in their Medicare, and apparently that it's been creating a lot of problems for seniors and for the federal government. For seniors, they're getting less care, and they're like I told you before, my dad has that type of policy, and I've mentioned this before, his neurologist was, when he was seeing his neurologist, he was in network, and sometime early last year, that neurologist was no longer in my dad's network, so he could no longer go to that neurologist anymore. And when he had his accident, his hip replacement surgery three years ago, they sent him first to, I believe, the hospital that they sent him first, I think, was Good Samaritan. Then they sent him to King Drew Medical Center, and then he got sent over to farther east of El Monte. I forget the name of the place, near Baldwin Park or Baldwin Hills. I forget that. And I think it's called Baldwin Park. So he got sent over there like 50 miles. I would say like it's around 25, 50 miles further east, way far away. Great Samaritan is much closer to where we live. And the day is, by the way, the ambulance. So when the ambulance pick you up, they try to just find the nearest hospital for you. His emergency was that he fell while riding in the bus, and he hurt his hip, and so they took him there, and they found, I guess when he got there, they must have gone through his personal stuff, and they found his Medicare, or they looked up his name, and they found out that his Medicare plan was not, that hospital was not in the network. Okay, so that they sent him elsewhere, and then the other place where they sent him, they also found out there that he also was not in that network. So that ride to the first hospital probably took 5 minutes, I would say, because the location was near, kind of close to downtown LA. But so it would probably taken them 5 minutes to get him from the bus to Great Samaritan. Probably from Great Samaritan to King, it probably took 15 to 20 minutes. And from King to the other place, it probably took them a half an hour or more. So all that time, that's roughly about 2 hours. If my dad had been losing blood, or if it was a really serious emergency, he could have died on the trip. So I did mention that before, that yeah, he has Medicare, and he doesn't have to worry about like the other people were paying into the system. But when you're the place that they're sending you to, or if you go to a place, if it's not in network, they can't see you. It's not covered by your Medicare plan. So unfortunately for him, and by the way, when he got taken in that day on 3 years ago, he was diagnosed with dementia when the doctor saw that they saw something wrong with him. We had no idea that he had that. So that's one of the problems of this Medicare Advantage. And he had signed up for it, I guess, sometime before, and we never knew much about what he did. He would do his own things, and I think some family members of his convinced him to get enrolled in Medicare Advantage. Because you think about it, you look at the title, right? Medicare Advantage. It sounds like it has an advantage from regular Medicare. So my experience with him having his Ultimate, that's his insurance company, it's just, you get a lot of runaround. It's a lot of paperwork. And when I started doing the job of a caretaker for him, and I really didn't know anything about his plans or anything, but we tried to get him the redo for his eye surgery. And I remember we looked for different eye surgeons, and I didn't know any better, so we just called one of the local hospitals that he went to, and they gave us some names, and I decided to call them. And I think on the second one they said, yeah, we can come and see him. So we went there and waited for hours to be called. Once we got called in, one of the ladies informed us, hey, you know what, your dad's insurance, we don't cover your dad's insurance. So we had wasted that entire day. And at that time, I didn't really know anything about the insurance company. But when I saw that, I was just like shocked that this was going on in this country. And so I told the lady, well, why did you guys tell us you can see us? You know, you should have told us on the phone that no, you know, that should have been told to us on the phone. And I think really what the answer there is, and I spoke to the person over her and mentioned that, and she said she promised she would talk to them to tell them not to do that again. But I think the answer to like, well, why that situation happened is because the system prioritizes profit, right? They prioritize these hospitals or clinics to get as many patients as they can, and the more patients that you have, then the more money you're going to get, right? Because they're going to be billing the Medicare plan, and the insurance company's going to bill the federal government, and so there's an incentive to try to get as many customers as you can, and I do see that happening with his current optometrist, the one that is in his network now. But I do see that they do tend to on some days they tend to schedule a lot of people, more people than they should be scheduling. You know, sometimes we do wait in the waiting room for more than an hour just to be seen by his ophthalmologist. So yeah, that's that system just needs to change, and it's sad. And it's sad because obviously these politicians, they're obviously getting campaign contributions from these companies. So it's just the public. The shooting is gonna just all it's doing right now is just raising awareness about all of this, but without people organizing and people mobilizing, it's just not. We're just not going to see any change happen at all. It's kind of like, I think that this guy really is kind of like our modern day John Brown. I was thinking about this earlier today. I think he's more like of our modern day John Brown. And if you think of John Brown, he raised awareness through violence, right? In Bleeding Kansas, and then finally in Harper's Ferry. But really his act didn't really fundamentally change slavery at all. It just raised awareness, right? And it caused a reaction. But it took the federal government getting organized, and his action actually caused a reaction. The South overreacted, and in the following year after Harper's Ferry, they just decided not to accept the results of the election that Lincoln won. So they separated from the Union and formed the Confederacy, and that's what really got the federal government finally starting to organize. And in 2 years, they issued Emancipation Proclamation. But it wasn't the violence in Harper's Ferry that did that at all. So we do need John Browns, but that in and of itself is not going to be enough, right? So we need people like the abolitionists back then, and we need people organizing in our local communities and trying to pick our battles And maybe we need a movement to get people to opt out of Medicare Advantage first, and try to see if we can phase out that system. Thank you so much for watching. Please like the live stream, subscribe to our PDR channel. Have a good evening, folks, and please be on the lookout for our future live streams. And thank you for watching us. Have a great day.